All right, thank you so much. Welcome to another episode of the Love, Hope, Lyme podcast. Of course, my name is Fred Diamond. I'm the author of Love, Hope, Lyme, what family members, partners, and friends who love a chronic Lyme survivor need to know. Thank you for being a viewer today. If you're watching this on YouTube, thank you so much. Subscribe, give us a thumbs up on this episode, ask a question, make a comment. Very excited to have today's guest, Dr. Neil Nathan. We're going to be talking in detail about his new book, The Sensitive Patient Healing Guide. Top experts offer new insights and treatments for environmental toxins, Lyme disease, and EMFs, electromagnetic frequencies. If you're listening to today's show on Apple Podcasts, thank you so much. Give us a 5-star review. We would greatly appreciate it. Dr. Nathan, I make my book, Love, Hope, Lyme, available for free. The e-version is free for chronic Lyme survivors. I've given out close to 1,500 copies. The book's been out for about a year and a half. If you're a chronic Lyme survivor, reach out to me on Facebook or LinkedIn or Instagram, YouTube, and I'd be happy to send you a PDF of the book. Of course, it's available on Amazon. I would greatly appreciate if you purchase it on Amazon to give a review as well. And Dr. Nathan, I also send out, a lot of people order like a dozen copies and they want to give them to family members, partners, and friends. If you're in that category, reach out to me via social media and I'd be happy to get them to you as well. And a lot of people know, they've heard my story in the summer of 2021, when I wanted to understand how Lyme disease affected someone in my life. I read every book. I went to Amazon and I bought probably 3 dozen books. One of the books that I purchased, which had a huge impact on me, was your book. I believe it was published in 2018, Toxic: Heal Your Body from Mold Toxicity, Lyme Disease, Multiple Chemical Sensitivities, and Chronic Environmental Illness. And that book had a big impact on me. I actually even wrote a couple of articles on the 10 books that most impacted me. In my book, Love, Hope, Lyme, I list that book as well. So I'm excited to have you here today. Again, your new book is out. And I just want to read something from the book to kind of tee up what we're going to be talking about. In the book, you say, for so many patients who have been marginalized, disrespected, ignored, and left with no hope or future, isolated from their spouses, families, and communities, the ones who have slowly become so sensitive and reactive to their environment that they have become severely limited in their connection to the world they used to love. Now, when I read that line, it kind of hit me, and I'm sure many people listening to today's podcast can relate to that. First of all, it's great to see you. Thank you so much for being here, and kudos for the tremendous work you've done for so many in your 50-year medical career. Talk about the book. Why did you publish this book now?
Well, I published it now because I think the world needs it now. When I started out in medical practice, which does go back a ways, as you say, so translation, yes, I'm old. When I first started out, I don't know that I saw very many patients who were very sensitive. But as the world evolved and as my practice evolved, I began to notice that I had more and more patients who had become sensitive to almost everything: light, sound, touch, food, chemicals, EMF. I began to see patients who were solid citizens, but they couldn't take even the tiniest dose of something I knew they needed because it measured low in their body. For example, I remember one woman who had horrible symptoms of menopause, but couldn't take the tiniest dose of bioidentical estrogen to just throw her off. And I knew she wasn't psychological on her. I knew that it was physical. I didn't know what to do for her. And over time, my practice grew to the point that almost every patient I saw was so sensitive. And I think this is a global phenomenon. This is not unique to me. It's not unique to my practice. More and more patients are what we call the canary in the coal mines.
Yeah.
Those patients who have become exquisitely sensitive to the point that they are no longer functional. In fact, there's a study that was done in England showing that at this point, 1% of the English population is so sensitive chemically sensitive, that they are disabled legally and receiving disability. And 35% of the population has some degree of sensitivities that they are aware of and noticing. So we're dealing with something that has gone from being non-existent to being an epidemic. And so I wrote this book because over the last 20 years, we have learned a tremendous amount about what's causing this and how to treat it. And I thought, honestly, the world needed to know that. So there are literally millions of people now who have become sensitized, who need help. And I enlisted 20 of my friends and colleagues to write chapters in the book. And so it is a who's who of people in the field so that readers can really benefit from not just my opinion, but the benefit of some of the top folks in the area to help them understand this is not in your head. This is very real, and we know how to treat it.
Yeah, that's a great point. As a matter of fact, I highly recommend the book. One of the chapters on Lyme specifically, Dr. Richard Horowitz was the co-author, and for people who don't know, he actually wrote the foreword to my book, Love, Hope, Lyme, and he's also been a guest on this podcast. And you said almost every patient who was presented to you with multiple chemical sensitivity, MCS, turned out to have a significant amount of mold toxicity and or a Bartonella infection. So for people who don't know, first of all, let's talk about Bartonella. And then of course, I want to get into mold. So help people understand what Bartonella is.
Bartonella is simply a bacteria that gets into our bodies. Some people call it a stealth infection because unlike certain other bacteria, Bartonella can hide from the immune system so that we can't get rid of it. It can hide by going intracellular, meaning it actually burrows into a cell so that the antibiotics we're using in the immune system can't really get at it very well. I mean, it also hides from the immune system by creating such a profound inflammatory response that the immune system runs around like a chicken with its head cut off, trying to put out fires and not actually getting to deal with Bartonella. So you can get Bartonella commonly with a tick bite.
Mhm.
When a tick bites an individual, it first takes blood from that individual into its stomach called a blood meal. Sorry, this is disgusting, but this is actually what happens.
Yeah.
And then after a period of time, it regurgitates that blood back into the patient. Dr. Burrascano calls this nature's dirty needle, meaning a variety of things get injected into the body. It's not just the Lyme bacteria, but Bartonella, Babesia, Ehrlichia, Anaplasma, a number of viruses. Depending on what's in the tick at the moment that it injects it, we can get it. So about 40% of the ticks in the United States, depending on region, carry Bartonella. You can also get it from flea bites. You can get it by being scratched or bitten by a cat. You can get it from biting flies and mosquitoes and other things. So although we associate it with Lyme, there's many ways you could get this bacteria in your body. And once it's in your body, it's fairly hard to eradicate unless you think about it. And not all physicians are aware of what Bartonella can do because it is treatable. And especially with the pioneering work that Dr. Horowitz has done, he's recently come up with his dapsone protocols, which has profoundly improved our results from treating Bartonella.
Absolutely. So does Bartonella always come with Lyme disease, or do you sometimes see, what I should say is, the uh, Burgdorferi bacteria, is it always associated, or sometimes do your patients have it by itself?
Commonly, you can get it by itself. You can get it with Lyme. You can get it with Babesia. You can get it with, and it's just so variable. It depends on what's in the tick when it bites you from that perspective. But again, I've had patients who got it from exposure to cats or fleas. And so you can get it by itself.
So one thing that a lot of the listeners know is Lyme, of course, is called the great imitator, where it represents itself as many different types of symptoms and diseases. What are some of the ways that Bartonella represents itself to the patients?
Well, it can do a lot of the things that Lyme can do, which is its basic nature is that it triggers inflammation. And the inflammation is systemic, means all the different parts of our body are susceptible to being inflamed. So you can get symptoms that vary widely depending on your own genetics or biochemistry, but almost always people will get fatigue, cognitive impairment, they may get headaches, joint pain, particularly for Bartonella, they may get pain on the bottom of their feet. It looks a little bit like plantar fasciitis. You can get an unusual type of rash called stria. Some people call them stretch marks in places that people don't usually get stretch marks.
Right.
Other rashes are also possible with Bartonella, and especially they can cause neurological and psychological issues. Profound fatigue, profound anxiety, panic, depression, feelings of hopelessness, OCD behavior. So there are many physicians in this country who are still not what we call Lyme literate. They don't know much about Lyme disease. And when a patient presents with all of this stuff, they may focus on the psychological pieces of it and go, okay, this is all in your head. You just need to take an antidepressant or a benzodiazepine or see a psychiatrist. This is too complicated for me. But the implication for many physicians is it's in your head. And it is not. It is a bacterial infection that can be treated.
Yeah. All right. So I want to talk about, you talk in the book about the three most important components of the perception of safety are the limbic system, the vagal nerve system, and of course, mast cell activation syndrome, MCAS. So let's talk about all three and let's go into detail. And then we're going to talk about some of the specific toxins that we talk about in the book as well. But take us through this so that people understand this. And again, these are some terms that people throw around. They may not know everything about them, but I want to spend some time here kind of giving people a good baseline so they understand what we're talking about and why it's so critical for their recovery. Again, most people listening to today's podcast reviewing on YouTube are trying to get out of this chronic Lyme disease and trying to get to some degree of remission or cure, if they will. So take us through limbic system and what exactly is that and how's that play here?
Okay. I'm going to do that, but I want to make a couple of preparatory comments.
Sure.
First, I want to emphasize that mold toxicity is at least as common as Lyme disease, maybe more common, and has the same symptoms because it is also an inflammatory process affecting everything that I just mentioned. And so it's extremely common for people to have both Lyme and mold. The reason for that, and it confuses folks, which is why would that be? It's that both weaken the immune system to the point that you become susceptible to the others. Lyme disease weakens the immune system so that you're more prone to mold toxicity if you're exposed. Mold toxicity weakens the immune system and predisposes to Lyme disease. So they often come hand in hand. For those of you in the Lyme community who are struggling with Lyme, if you haven't looked at mold toxicity as a component, please do immediately, because a lot of doctors in the Lyme community, as wonderful as they are, don't all know about mold. And so many will go, you still have symptoms, you're not better, you must still have fill in the blank, Lyme, Babesia, Bartonella. So I need to keep giving antibiotics to you. You may have already been successfully treated for those, and it may be mold that is causing that. So this is a please statement. Please, if you have Lyme, look for mold also. I will share with you, since I teach with Dr. Horowitz, that he has recently shared with me that quite a few of his patients who were not recovering from his treatments, and I think he's the best Lyme doc in the country, didn't recover until he tested them for mold and treated them for mold. So super important. Within that context, let's talk about the inflammation that mold and Lyme trigger will affect several parts of the brain, namely the limbic system and the vagal system, and they will affect what is called mast cells. So let's talk about those three. One more preparatory comment. The body cannot heal if it doesn't feel safe. One more time. Body cannot heal if it doesn't feel safe. The parts of our body that monitor us for safety and regulate and control it are the limbic system, the vagal system, and mast cell activation. I call that the trifecta of sensitivity. So let's take them one at a time. The limbic system is the part of our brain that monitors, regulates, and controls two main things: emotion and sensitivity. So if you have symptoms that are related to sensitivity to light, sound, touch, chemicals, smells, EMF, and food, that's limbic. If you also have, or in addition have, anxiety, panic, depression, OCD, or a worsening of any psychological issue, mood swings, cognitive impairment, limbic. So the vast majority of my patients with mold and Lyme have some degree of limbic impairment. And one of the things that's keeping them from getting better is that they don't know it and they're not treating it. So for most people, this has to be addressed early in treatment, not later. You have to get the body safer for it to be able to respond to the treatments that otherwise would work for Lyme, mold, Bartonella, and what have you. That's the limbic system. What we call the vagal nerve system, and that sounds like a lot of languaging. The vagus nerve is the 10th cranial nerve, but it is a system. It isn't just the vagus that's affected, but it is the vagus nerve and the other cranial nerves that are coming out of the brainstem right next to it. So we're dealing not just with the vagus nerve, we're dealing with the glossopharyngeal nerve, the 11th and 12th cranial nerves, the facial nerve, the trigeminal nerve. It's a system. And when it gets inflamed, again, its job is also to monitor the body for safety in a different way than the limbic system does. So it has other symptoms that would tip us off to the fact that the vagus system is unhappy and dysfunctional. Number one, the vagus nerve goes to the lungs, the heart, and the entire intestinal system. So any symptom that you have in those areas is likely have a vagal component to it. The vagus nerve controls intestinal motility, so that if you have gas, bloating, indigestion, reflux, diarrhea, constipation, think vagal. If you have palpitations of the heart, shortness of breath, think vagal. The vagus nerve controls what we call the autonomic nervous system. So when people develop POTS, which is an irregularity of their ability to regulate blood pressure and pulse, that's vagal. If you have temperature dysregulation, where I'm hot, I'm cold, I can't tolerate heat, I can't tolerate cold, also autonomic nervous dysfunction. So again, the majority of patients with Lyme and mold have some of those symptoms. And so we're looking at not just limbic, but limbic and vagal systems. And the two systems of our nervous system work very complicatedly together to monitor our environment for safety. And if they don't think we're safe, they're going to give us symptoms to make us aware of it. Those symptoms are highly unpleasant, but they're not trying to hurt us. They're trying to tell us, I think you're doing something that's not safe, and I'm not going to let you do it.
Mm.
This is, want to emphasize it, not psychological. This is neurological. So the treatment is not psychological. It's literally rebooting the limbic and vagal systems, which we now know how to do.
Wow.
The last part of the trifecta is what's called mast cell activation. Mast cells are a type of immune cell that is present in every part of our body, but especially present in the tissues of our body exposed to the outside world, where, as you would want an immune response to be in contact with the outside world so it can monitor, once again, for safety. So again, the mast cells interface with the limbic and vagal system. So it isn't enough to treat one of them. You have to treat all three of them to restore safety, which will not only make most of our patients feel much better fairly quickly, but it will set the table by which they can heal by responding to our treatments. And mast cell symptoms are a little bit different. A keynote would be if you have any symptom that shows up while you start to eat or within 15, 20 minutes of eating, that is highly likely to be mast cell activation. Okay. There are tests for mast cell activation, but they are fairly, very inadequate. So I've had dozens and dozens and dozens of patients who've been to the major medical centers of this country where they've gone to mast cell activation clinics and been told because they have a negative blood test, you can't have mast cell activation, so we're not going to treat you. So the tests are lousy. If you have these symptoms and you have the predisposition that mold and Lyme trigger, okay, please, it's just easy to treat. It's not complicated. And when you respond well to the treatment for mast cell activation, I had it and I can treat it. So that's the trifecta.
I want to go back to mold for a second, though. Can you get basic for us on mold? So I see mold asked a lot of times. Is it basically you living in a moldy house or a moldy office? Is that really at its core what it is? Or can you have a mold problem without there being mold in the house? Maybe something genetic or something? Explain exactly what the mold problem is.
There's some controversy here, but it's not genetic. You may be a smidge more predisposed than someone because of your genetics, but it has to do with exposure, and it's about exposure to water-damaged buildings.
Okay.
It comes from breathing the air which contains mold spores in water-damaged buildings. There are some people who believe there's a tremendous amount in the food we eat, and most of us don't believe that that's correct. I certainly don't, and I've done some studies that kind of prove that. I'll leave that as controversial for a bit, because although there are some foods that contain minuscule amounts of mold, it's only in rare cases, and these are reported, where people who got their peanuts from a moldy silo or their grain from a moldy silo, whole communities have become mold toxic from that kind of exposure. But now our food is being evaluated by governmental agencies. It's a little bit, not enough to make us sick. We're getting it from the air in moldy buildings.
So do you tell people move out of moldy buildings, or can someone have been in a moldy building for a year and maybe they still have the problems even though they've moved away, or a moldy office or something?
Oh, yes, they can.
Okay.
So first of all, depending on the strength of your immune system, you could be exposed to mold and not get sick from it for a while. But if your immune system takes a hit where, I don't know, you had surgery, death of a loved one, ongoing abuse, infections of different types that are severe, like COVID, if the immune system takes a hit, it can no longer contain the inflammation triggered by mold and set it off. Another thing, and it's very important to know, you could have been in a moldy building 10 years ago and left that building. But if the mold got into your body, we call it colonization, and mold will typically colonize in the sinus and gut areas. Again, if your immune system takes a hit, you could now be living in a pristine environment, but your body is making mold internally, and you can certainly have that.
All right, we're talking today with Dr. Neil Nathan, the author of the Sensitive Patient's Healing Guide. This has been fascinating. By the way, I highly recommend the book to people. It's if you have chronic Lyme disease, or if you're dealing with mold or any of the sensitive patient issues, you're going to be turning this pages of the book, because it's going to be so relevant to what you're going through. Dr. Nathan, I want to hit on a couple of topics here, and I just want to congratulate you on the book. So let's just hit a couple of them here. So of course, we're talking about toxicity. With toxicity comes detox. So give us some of your insights on what detox looks like. What are some of your thoughts on some of the detox strategies that our listeners should consider?
Well, toxicity is simply having toxins in your body. Now, Mold toxin is more obvious, but both Lyme and Bartonella and other Lyme components, when we kill them, make toxins also. So we can get toxic from infections, we can get toxins from mold toxicity, and there are environmental toxins of all kinds. So toxins are simply substances in our body that our immune system cannot handle and typically will trigger an inflammatory response. So for both mold and for Lyme, one of the things we've learned along the way is we have to help our bodies improve their ability to detoxify. Now, in mold, it's especially tricky because mold toxin messes with the body's ability to detoxify. So it's you have to actually get the mold out to get better. Yes, helping detoxification can occur, but it's tricky. You can't just take things that help toxins get out of the body because they may mobilize toxin faster than our ability to get rid of them, and we will actually get worse. For example, one of the substances that we use to help people detoxify is glutathione.
Mm.
Great substance, if your body will let you take it. So for many of my more sensitive patients, the slightest whiff of glutathione will mobilize toxin faster than they can deal with it, and they will get worse. So there is not a one-size-fits-all way of detoxifying. Same thing's true of saunas. Saunas are a great way to get rid of toxins in the body. But if you take it for too long or at too high a temperature, or you sweat too much, you can get worse because you're actually mobilizing toxins. So we can also gently help the organs of detoxification work better. The liver is the major organ of detoxification. We have a host of supplements that we can take to improve that. We need the gallbladder to work better to detoxify. The gut is an organ of detoxification. That has to work better. The skin is an organ of detoxification, which is why sweating is so helpful. The kidneys is an organ of detoxification. So when we get into this field, we have to be aware of and cautious with all of the ways that we help toxins to get out of the body, because we have to do it at a pace that the body can tolerate.
Wow. One of the things we didn't talk about, which of course is in the subtitle of the book, top experts offer new insights and treatments for environmental toxins, Lyme disease, and EMFs, electromagnetic frequencies. Talk a little bit about EMFs and why did you cover that in the book, and what do our people need to know?
Well, I covered it in the book because over time it has become a major missed piece of what's making people sick. Although AT&T and Verizon and company would have you believe that their exposures are trivial and that more is better, that is not true for a whole lot of people. For example, when we changed from 4G to 5G, people think, oh, we just went up one number. No, we increased the exposure 1,000-fold to the electromagnetic frequencies that we're being exposed to. And a lot of people get sick from it. So what does EMF toxicity, if you will, look like? Well, if you're working on a computer or on your cell phone for a long period of time, you can begin to be cognitive impairment, can't think straight, get a headache, become fatigued in a way you shouldn't. You can get neurological symptoms. There are different kinds of seizures that you can get, or dyskinesias, twitching movements that you can get. So this is a very real thing. And once again, our patients are being dismissed as, oh, that's crazy. I'm in the same room you are, and I'm using the same computer, and I'm fine. People say that about being in a moldy house, for example. Well, we're all different, so that we are all genetically and biochemically unique. And so what will make one person sick, another person can tolerate. So it's very important for us as human beings to look at our fellow human beings and go, I don't know what your life is like, but there's no reason I can't believe what you're telling me. There's
Yes.
no reason you should be making this up.
Yes.
So the EMF issue is a big one, especially because a lot of people don't believe in it. But it is a very real process. A biochemist named Martin Pall has done some studies showing the actual biochemistry of what these things do to sensitive patients.
Wow.
And it's a very real process. And we can block EMFs, and EMFs are a part of sensitization, so that, again, treating the limbic and vagal and mast cell systems, which are involved here, will help quiet that down.
Two more topics before we wrap up today. You touch on heavy metals, and heavy metals is something that I've seen numerous people talk about, and how that sometimes inhibits detoxification. Talk for a second or two about heavy metals and how they play in this.
Sure. What we call heavy metals or toxic metals include things like mercury, lead, cadmium, barium, gadolinium, you name it. They're all metal ions in our environment that, depending on our exposure, we may have gotten. Also, they're not easy to measure. There are some physicians who will check it in a urine or check it in blood. If you have it, it is not likely to be there, because the heavy metals all have a predisposition for being absorbed or working in one particular tissue. Example, mercury is a big one here. Mercury accumulates and is stored in nerve tissue and the brain. So if you have Alzheimer's disease or Parkinson's or ALS or cognitive impairment, headaches, think the possibility of mercury, which can be acquired from the fillings in your mouth if you've ever had them. Even if you had your fillings taken out, they may still be in your body because you never did anything to get the toxicity of their out. Lead toxicity is fairly common. Arsenic toxicity is very common. Most of the country's water supply system is too heavy in arsenic, and people don't know it, but you can get your water tested. So this is another piece of the puzzle that affects the immune system. It's a trigger for autoimmunity, just like mold and Lyme is. So again, it's another toxin. One of the major concepts in toxicology is what we call toxic load, meaning the mold may simply be the straw that breaks the camel's back, because you have a lifetime of accumulating toxins in your body, and then this is just the last straw. Now your liver, which was handling this, now goes, I've got too much to handle. I can't keep up with trying to get this out. So these are all things that need to be looked at for anyone who is chronically ill, because this is my take-home message. Everything I'm talking about today is treatable.
Before I ask you for your final thought, again, we talked today with Dr. Neil Nathan. His new book, The Sensitive Patient's Healing Guide, top experts offer new insights and treatments for environmental toxins, Lyme disease, and electromagnetic frequencies. I just want to read something, another excerpt from the book, which was very powerful, I felt, which kind of sums up a lot of what you've been telling us today. And you say in the book, above all, this is the book of hope for those who have been told, often repeatedly, that they have to, quote, live with it, unquote, and have had to isolate themselves from the world in order to survive. We, the authors, have helped thousands of patients recover their health and rejoin their families and communities with a new sense of purpose and meaning. If you're struggling with medical conditions that have left you in this condition, we are hoping you will join them. So I highly recommend the book. Again, if you're struggling with a lot of what we're talking about today, if you're dealing with mold, if you're dealing with Lyme, if you're dealing with other sensitivities and toxins, it will open up a lot of answers for you, and it will address a lot of things that you're struggling with. Dr. Nathan, again, I want to acknowledge you for the, probably by this point, hundreds of thousands of people that you've helped deal with challenges like this. These are very, very frustrating challenges. You know, you talked about how they're treatable. I agree, but they're very difficult, especially when you get into this world, when we talk about all the things that we've talked about on the show. You know, the analogy we use is if you break an ankle anywhere around the planet, you're going to get an x-ray, you're going to get into a cast or a boot, you're going to sit on your butt for 6 weeks, and then you're going to rehab if you're in Sydney, Siberia. or Sacramento. If you have Lyme and some of the other tick-borne vector illnesses, they're so complicated. And thank God there are doctors like you who understand this and hopefully are educating other doctors. I want to ask you that question. You touch on this in the book. How are we educating doctors, new and experienced, on these things? Obviously, your book is published. You refer to Dr. Horwitz, who's written a couple of books, How Can I Get Better, et cetera. What is some of your advice to get the rest of the medical profession educated on this?
Well, that's been my focus for the last 3, 4, maybe 10 years, is trying to educate physicians. I currently have a mentorship program that I do with Dr. Jill Christa, a naturopathic physician who's an expert on this as well. We have over 200 physicians who are training with us in learning how to do this better. And so it's focused on what we call chronic inflammatory illnesses, which are all of the things that we've been talking about. And we have every 2 months, we have a meeting on Saturday mornings where we go over cases. And once a year, I bring in a whole bunch of experts and we have a whole day of talking about the things that are most on our mind, or what are the areas that most need addressing and figuring out. So I'm proud of that. That group, which is, we're training future docs to do that. And as often as I can, I speak at medical meetings, trying to share what I've learned, because we need more doctors doing this. Absolutely.
Once again, I want to thank Dr. Nathan. Any final thoughts you want to communicate?
Again, I'm into your message, which is love, hope, Lyme, mold, whatever, but that we have learned enough that we can help most of our patients recover fairly completely or completely from these illnesses. So if you have not been helped so far, do not give up. Find someone who knows what they're doing and get the help that you need. But we now know enough that we really can help most people. So hang in there.
All right. Thank you so much. Once again, I want to thank Dr. Neil Nathan. My name is Fred Diamond, and this is the Love, Hope, Lyme podcast.